The coronavirus outbreak. Basketball games in South Korea are being scheduled to resume the end of this month.
Really?
Though in empty arenas.
Well, that's good news because yesterday we heard about the New York Knicks and 4 of their players, including Kevin Durant, have tested positive.
That would be the Brooklyn
COVID.
Nets.
I'm sorry, the Brooklyn Nets.
Yeah.
Excuse me.
But let's just hold the phone on South Korea.
Okay.
Science magazine piece looking at trying to answer the question, what's the secret to South Korea's success? Country of 50 million people appears to have greatly slowed its epidemic. It reported only 74 new cases as of the writing of this article yesterday, down from 909 at its peak at the end of February. And it's done so without locking down entire cities or taking some of the other authoritarian measures that helped China bring its epidemic under control. In fact, the president of South Korea is saying it's a democratic republic. We feel a lockdown is not a reasonable choice. And so it was diagnostic testing that has been reported widely to have been the key to controlling the outbreak. Diagnostic testing, identifying who's infected, and then obviously the quarantine. That's the second piece of it.
And they're the ones that started with the drive-through testing.
But there was some subtext that was lost in a lot of the reporting. So people understandably looking, is there some model I can replicate? Is this a model I can replicate? Have they figured it out? Can we? I get it. But you have to, they're testing 10,000 people a day. And they did. They tested more than any other country. 270,000 people in a 50 million person country. It's significant. But when we started getting more of the reporting back, we found a lot of the testing was false positives for other respiratory illnesses, not COVID-19. Nonetheless, it still looks like they've, at minimum, flattened the curve, to borrow a Tony Fauciism. However, these scientists writing in Science magazine,
What?
are they scheduled for another outbreak?
Oh,
Whether the success will hold is unclear. New case numbers are declining largely because of the Herculean effort to investigate a massive cluster of more than 5,000 cases, 60% of the nation's total, near a particular mega church in that country.
That's right.
Right?
Yeah.
New clusters, the Science magazine reporting, new clusters are now appearing. Since last week, authorities have reported 129 new infections, most linked to a call center in Seoul. This could be the initiation of a community spread, and the region of Seoul is home to 23 million people. And it goes on to talk about the lessons they learned from MERS. So I'm not saying that South Korea hasn't done a lot of the right things since the outbreak, and I'm not saying that they're going to have another outbreak or they're not going to be able to contain it the way that they seem to have, get on that downside of that flattened curve. As we're learning the vernacular. But I'm just, you have scientists that are watching this in the detail that's required, looking at measures taken and actual consequences rather than just measuring the volume or assessing the volume of measures taken. You have to look at what the results you're getting, too, and how those results may change. You think you've got it licked one day, and now a cluster pops up near a call center or at a call center near a call center in Seoul. So, all of this it's just a way to, again, exercise restraint, talk about what we know to be true, and continue to ask the questions about what we hope to understand to be true or false so that we can be informed in the decisions we make and the information we share. And so this is why you have to rely on people who, know what they're talking about, which generally means not politicians. Cleveland Clinic CEO Dr. Tom Mihaljevic, he was on with Maria Bartiromo talking about another issue that I think there's a lot of panic around, which is the healthcare infrastructure in this country. Could it handle the kind of level of infections that some modeling is predicting? Here's what the Cleveland Clinic CEO said.
Healthcare systems have their own contingency and emergency preparedness, and that has been in place in systems like ours since early January when we started tracking the COVID-19 epidemic back then, and have developed plans to ramp up our capacity and availability of space and ventilators appropriately. At this moment, At this moment, healthcare systems have more than enough capacity to serve all of those in need. And our future ability to do so will depend primarily on our ability to contain the epidemic and what is now called flatten the curve so that we do not overwhelm the healthcare system at once.
Well, so it's not doing one thing, it's synchronizing all the things. And I think that needs to be driven home in a way that it's not being done as effectively as it could be. For more on this topic, we're pleased to be joined by Bradley Blakeman. He's former Deputy Assistant to President George W. Bush, principal of the 1600 Group, and adjunct professor of public policy and international affairs at G-Town. That would be Georgetown University. Bradley, thanks for joining us. Appreciate it.
Yeah, my pleasure.
So as somebody who was a deputy assistant to a president, how would you assess the response from all of the professionals, including, of course, the President of the United States, to this point, and the communication of what's being done to bring people along every step of the way?
Well, as somebody who was in the White House on 9/11, I have witnessed firsthand the response of a crisis to a proportion that our country had not seen on an attack on America. This is the equivalent of that and more, because this is affecting every American directly. Unforeseen and silent enemy. I think the president has done a great job of getting professionals surrounding him who can give him good decisions that he can make. He's made good decisions, tough decisions, and I think so far so good. But we're still going through this, and there's a cause and effect. We see a wave coming, but we don't know how it's going to affect the shore until it hits. But we can see it coming, and we have to prepare, and we have to do everything in good common sense and judgment to protect as many people as possible. And I'd like a cop on every corner, but that is not doable. What we have to make sure is the cops are there and the medical people are there for the people who need it the most, and everybody else needs to stand down and follow direction. And at a time of crisis, you're only as good as those making decisions and those who will follow them.
Yeah. Do you think there should be a 2-week national a lockdown?
It's only if there's evidence to believe that it's necessary. We should only be doing things that are absolutely necessary. And at the end of the day, I agree with Dr. Fauci. Sometimes you overreact. Overreaction is a good thing if it's done in good faith and with a good faith belief that it's going to help. But we should follow the directions of the professionals, in my opinion.
One of the things that seems to me, just in terms of the media coverage, of course, everybody focuses on the president and the federal level, except when states start doing things like, locking down bars and restaurants and potentially locking down an entire city the way San Francisco has, or a state the way that Pennsylvania has. But I liked your piece, The Hill, the other day about local pharmacies and the role that local pharmacies have to play in this, much like we talk about the role that state and local governments have to play. All our hopes and dreams and preventative measures don't emanate from the federal government, which is why they're promulgating guidelines, not edicts. And you have to make intelligent decisions at the local level, within our decentralized, freer society than most. And so when the president last week at his Friday briefing had the CEOs of, the big pharma companies and, the home healthcare companies, but also CVS and Walgreens there, the role that pharmacies have to play in helping us get to the other side of this.
There's no doubt. We know that 95% of Americans live within 5 miles of a retail pharmacy. It's not necessarily a CVS; it could be a small community pharmacy.
Right.
And those caregivers and suppliers are right in their neighborhoods. They know their pharmacists. They visit there regularly for product or for prescription. And it makes good sense to cut the red tape and let the pharmacies step up and deliver wellness and also deliver healthcare and prescriptions and testing. This makes perfect sense. They're everywhere. They're known to the citizens. The citizens visit there regularly. And what we need to do is make sure that healthcare is provided in the safest, simplest, easiest, affordable way to the people who need it most. And a person going to a pharmacy for a test is one less person going to a hospital or a clinic or a doctor and taking up space from somebody who really needs that kind of attention. So it just makes perfect sense. Out of this pandemic, we're gonna better our healthcare system.
Well, that's where I wanted to go to, because to use the war metaphor that too many are using, so I'll just join in. We have a tendency when we're talking about actual war to fight the last war. That was some criticism lodged against President George W. Bush and how the wars in Iraq and Afghanistan were prosecuted. What lessons did we learn from Gulf War I? Maybe not enough of them. And sort of the same thing here, and I go back to South Korea and the discussion of the lessons they learned from the MERS outbreak that they're applying or attempting to apply to the coronavirus outbreak. And so the same thing in the healthcare space. What lessons have we learned from the viral outbreaks of the last 2 or 3 decades that we're applying now or that will apply to future pandemics? And you point out the retail pharmacies as one of those.
Absolutely, and it just makes such sense that we should be empowering businesses who can step up more. They're willing to do it. They have the capacity to do it. They already have the infrastructure. So why not provide more services locally and free up hospitals? And we know that beds are a premium, especially those in ICU, and deliver services in a much better and efficient way to people who need it, and give, most importantly, peace of mind to people that they know where they need to go. And at times of emergency, the best thing to do is to free up the system because the people who need it most are the people who should get the care. And I'm pleased that President Trump has cut through red tape quickly. I'm pleased that the small, medium, and large pharmacies have willingly taken on this responsibility. And we are going to be well more prepared for this event as it proceeds, but more importantly in the future, this is going to be much easier to respond to because we're going to have testing centers. We're going to have the ability for wellness care at a delivery point that's much more accessible to the people.
Well, do you think everybody in America should get tested?
No, we should follow, again, the direction of the professionals. Not every American should or need to be tested. A lot of people want to be tested, but there are a lot of things we want in this world, but do we really need it? And that's the key, is we need to follow the directions of the professionals and not be selfish. You have to stand down and let the system care for those who need it most.
Let me ask you a political question, since you were, again, a former deputy assistant to President George W. Bush. You were in the White House, part of this decision-making process, particularly after 9/11, and including on the economic side. The decision by Mitch McConnell yesterday to go ahead and vote up what the House sent over and then do something in addition to that as sort of a good faith show of bipartisanship. I understand what he's doing on the politics side, but if they think it's bad policy, then I don't know what good faith in advancing bad policy gets you.
Well, look, it takes two to tango. You don't get everything you want. We have a divided government, and Mitch McConnell's right. We don't have time to waste. If there are some things in the bill that ordinarily we wouldn't want in there as a Republican, then you just got to swallow it, and because for the betterment of all, you got to take the bill as it exists and get it out there, because the bottom line is people need help, and we're at war. And when at times of war, you got to do things that ordinarily you wouldn't do, but people are hurting, and they deserve our help. And if we can spend trillions of dollars to help people overseas who are less thankful, quite frankly, for the help that we do give them, we can certainly help our own. And this is not a time to be penny pinching or to be second guessing. When there are people hurting, we need to respond.
He is Bradley Blakeman, former deputy assistant to President George W. Bush from 01 to 04, principal of the 1600 Group, adjunct professor of public policy and international affairs at Georgetown University. Check out his piece at thehill.com, which I'll tweet out at Dan Proft, about retail pharmacies. Very good. Bradley Blakeman, thanks so much for joining us. Appreciate it.
My pleasure. Take care.
And he joined us on our turnkey.pro answer line.
The more you listen, the more you'll know. This is Chicago's Morning Answer. Morning Answer on AM 560. The Answer.
Hey, Greg, I'm so sorry to hear about your brother's heart attack. Thanks. He's okay now, but it really got me thinking about my family. You know, could my wife still pay our mortgage if I had a heart problem?
Yeah, you should call my life insurance agent at Health IQ. They apply their exclusive healthy lifestyle savings, which can save you up to 41%.
41%? That's huge.
Yep, I literally got $1 million in coverage for just $36 a month. You should check it out at healthiq.com/easy.